Hi friends. So today we are going to see anatomy of the ear. Ear is divided into three parts: external ear, middle ear, and the inner ear. So today's our topic is the anatomy of the external ear. Okay. Middle ear is the very important things, and we will discuss it in next video. In the external ear, it's important for the clinical purpose. Okay. So you have to know some things in the external ear. Okay, so this is external ear. External ear consists of pinna. One thing is the pinna, and second thing is the external auditory canal. So this is the external auditory canal. Right. Now tympanic membrane, see, this tympanic membrane is forming just lateral wall of the middle ear. Okay, so in this video we will cover tympanic membrane, also we will cover tympanic membrane. Okay, so starting with the pinna. So starting with the pinna, see here, this pinna is the outermost part. Okay, this part is pinna. Okay, and this pinna has two surfaces. Pinna has two surfaces. One is the lateral surface and second is the medial surface. Alright, see here, this is the pinna. So two surfaces, one surface, second surface. Okay, so this surface is the laterally. So this is the lateral surface and this is the medial surface. So lateral and medial, two surfaces, right? Now, one thing you have to remember, that is the pinna is formed by yellow cartilage. Okay, these things you have to remember. Okay, pinna is formed by yellow cartilage and it has two surfaces. Tell me why yellow cartilage? Why? What is the reason? Okay, and what is the importance of this? So yellow cartilage, it never ossifies. Right? So pinna is formed by the yellow cartilage and it never ossifies. Two surfaces, lateral and the medial. Now we are going to see the lateral surface. See here, this is the lateral surface. This outer part is the helix. You just assume. We are talking about this here, right? This is the helix. So this part, outer part, this part is the helix. Now is the anti-helix. Second, this is the first elevation, this is the second elevation. Can you see here? This is the second elevation, right? So that is called anti-helix. And lobule, this part is the lobe, right? Now, this is the crest of the helix. From here to up to this. This is the crest of the helix here. This is the helix and this part is the crest of helix. Tragus, this part is the tragus. Tragus is somewhat here. This is the tragus, am I right? Antitragus. So tragus is here, antitragus is somewhat here, right? So tragus, antitragus, lobes, crest of the helix, and here is the one triangular fossa. Triangular fossa is here. Okay, so this is what? This is the anti-helix and this is the helix. So there is one triangular fossa, and this is the simba concave. And this part that is here, this part is the concha. Right? Now, one thing we have to remember, it's very important one thing, and we have to know about this incisura terminalis. Okay, so what is this incisura terminalis? It is the area. Okay, there is no cartilage between the crest of the helix and the tragus. Yes, and that part is called incisura terminalis. Okay, what is the clinical importance? Clinical importance. What is the clinical importance of the incisura terminalis? So, if you want to perform any surgery for the external auditory canal, okay, so we can make an incision along this area. Since there is no cartilage, okay, so there is no chance for injury to the cartilage. Okay, so since this is the cartilage free part, okay, so we can easily make a incision. For surgery, right? Surgery for what? External auditory canal. Okay, and already I told you that the pinna is formed by the yellow cartilage. Okay, if we will cut the cartilage part, so it will never get ossified. So this is the only part from where we can make one incision for the surgery performing for this external auditory canal. Okay, and sometimes for mastoid cavity. Okay, also we can make incision from here. So this is the incision terminal. This is what blue color part. This is the cartilage part, right? So this is the cartilage part, and this part, this is the lobule. So okay, so this lobe is formed by fibrofatty tissue of the lobe. This is the fibrofatty tissue. Okay, lobe is formed by fibrofatty tissue. Okay, and what is the importance of the pinna? And before going on that topic, a nerve supply of the pinna is the important. So now nerve supply. Nerve supply of the pinna is important. Okay, so exam can ask, okay, in the Viva now, what is the nerve supply of the pinna? Okay, and it's also important for the theory exam. So I want to tell you by in the order. So in the lateral surface, first of all, in the lateral surface. Lateral surface. This is the lateral surface, right? So anterior, upper two-third and the lower two-third. So here is the upper two-third and lower one-third. And this part is what? Concha, right? So concha. So this upper two-third is supplied by which part? And after that we will see the middle surface or medial surface, right? Medial surface. So tell me the lateral surface, upper two-third. This part is the upper two-third. Okay, and here is the lower one-third. And this concha, this all are supplied by this is the, I want to rough this part. So here I can tell you the nerve supply of the pinna. Nerve supply of the pinna. First nerve is the great auricular nerve. First thing. Second thing is the lesser occipital nerve. Third thing, cranial number 7th and 10th. That is the vagus, facial and the vagus. And one more, auriculotemporal nerve. Auriculotemporal nerve. Examiner can ask what is the root value of the great auricular nerve. That is the C2 and the C3. Root value of the lesser occipital nerve is the C2. Now you think, lesser occipital nerve. Occipital region is this. This is the occipital region, am I right? So lesser occipital nerve is supplying this part. Medially, upper two-third. See here. This is the medial, right? I think it's visible. So, upper two-third. Medial surface and upper two-third is supplied by lesser occipital nerve. So, lesser occipital nerve. Right? Root value is C2. Now, lower one-third of the medial surface and the lower one-third of the lateral surface. Okay, both are supplied by a great auricular nerve. Okay, so great auricular nerve, right? Here is also great auricular nerve, right? Yes. Now, this auriculotemporal nerve supplying this upper two-third. Upper two-third of the lateral surface. And this concha is supplied by a branch from vagus. So, 10th cranial nerve, right? And that branch is called what? Elderman's nerve. Elderman's nerve. Okay. कौन का supply है? Elderman's nerve, right? So this is the nerve supply. What is the artery supply of the pinna? It's important. Artery supply of the pinna is the important thing. So here arterial supply. Can you tell me artery supply? See, pinna is here. I am starting from the common carotid artery, give rise to two branches: external carotid artery and internal carotid artery. From external carotid artery, what are the terminal branches of the external artery? Superficial temporal nerve, right? So superficial temporal nerve is going from here, and the pinna is here, right? Am I right? From here to here. So one thing is the superficial temporal artery. Superficial temporal artery, right? Second thing is the posterior auricular artery, which is a branch of external carotid artery. Okay, so this is the artery supply of the pinna, right? And this is the external features, artery supply over, now supply over pinna, yellow cartilage, and that one thing is the this yellow cartilage, you remember. And okay, now we are moving on the now we are moving in the on the external auditory canal. Okay, can you tell me the what is the embryology for the auricle? I am writing here auricle. What is the embryology? It's very common question. So 6 mesodermal tubercle. Okay, so this is the embryology of the auricles. Okay, so now we are moving in the external auditory canal. So I want to rough all this. Okay, so you should remember the nerve supply of the pinna and artery supply of the pinna. What are the main parts of the pinna? Okay, so this pinna has two type of muscles, extrinsic and intrinsic muscles. They are rudimentary in the humans. Okay, so now I am starting external auditory canal. Can you tell me the parts of the external auditory canal? Can you tell me the nerve supply? Can you tell me the artery supply of the external auditory canal? So this external auditory canal, first of all I want to tell you the normal things, that is the length. It has length 24 mm. Yes, mm. Yes, and it has two parts. It has two parts. One part is that is called cartilaginous part, and one part is the bony part. So one part is the bony part, and second is the cartilaginous part, right? Examiner will ask common things. Okay, favorite question is what is the difference between cartilaginous part and the bony part? Okay, so one by one we are going to see. First thing, length of the external auditory canal is the 24 mm. Am I right? Yes. Now cartilage part is the just 8 mm, and this is the outer 1/3. This is the outer 1/3. Okay, and here is the length is the 16 mm. Am I right? 16 mm, and this is the inner 2/3. First thing. Second thing, here is present here in the cartilage part where it's absent in bony part. Sebaceous gland present here where it's absent here. Am I right? The skin, here the skin is very thick, and here skin is thin. Am I right? Now this area is the less painful, right? And this is the more painful. Am I right? Yes. So these are the difference between cartilage and the bony part. One things you should remember. Okay, anterior surface of this external auditory canal, there is two recesses you can tell. Two feces you can tell. One thing here is the foramen of Huska, right? And here is the one thing that is called, here is one thing, sir, and that is called, here is the foramen of skin, here is the Santorini. Okay, this is for the Santorini. So because of this two, one is the physis for the Santorini, and because of this foramen of the Huska, any infection from the external auditory canal, yes, any infection from the external auditory canal, it will reach to the parotid gland. Parotid gland, okay. So, an infection from the external auditory canal can be reached up to the parotid gland, okay, because of this foramen of the Huska, and this is the physis of the Santorini, okay, and vice versa. An infection from the parotid gland also can go to the external auditory canal. Am I right? It's this condition is seen in infants only, right? 1 year, okay. In some books it's mentioned up to the 4 year, okay. So you remember less than 4 years is the also right, okay. And after that what happening? After that what happening, that this physis is getting close, so in the adult is not this infection can't transmit, okay. So this is the common difference between the bony part and the cartilaginous part. Now one thing is the external auditory canal, okay. Epithelium, can you tell me the epithelium? Epithelium, that is the squamous, stratified, squamous epithelium. This is the epithelium. Length, this all are the difference, and this infection. And the next thing we have to move on the nerve supply, right? So nerve supply of the external auditory canal, I am writing here. Nerve supply. I hope it's visible. Nerve supply. Now see, nerve supply. External auditory canal. If you want to draw the one diagram, then draw like this. See, this is what. This is your external ear, and this is your auditory. This is the external auditory, and here is the tympanic membrane, and after that this is what middle ear. Okay. One thing, external auditory canal is not straightforward. Yes, it's not straight. Okay. I will tell you the directions. Okay. So now, nerve supply. What is the nerve supply? So what I am trying to tell is this external auditory canal has one roof. Yes, roof, one floor. Yes, this is the anterior wall, and behind this is the posterior wall. So anterior wall and the posterior wall. Am I right? Yes. So now roof and the anterior wall. Roof and anterior wall is supplied by what? Auriculotemporal now only. Okay. So auriculotemporal now. Am I right? Now floor and posterior wall. Here is the floor and the posterior wall is the supplied by from where, from what? Can you tell me? Auricular branch of the vagus. Auricular branch of vagus. So this is the nerve supply of external auditory canal. Now can you tell me the artery supply? Here is the artery supply. Arterial supply. What artery? One is the deep auricular artery. Deep auricular artery. Can you tell me deep auricular artery is a branch of thing? Second is the posterior auricular artery. Okay. So deep auricular artery is a branch of first part of the maxillary artery. Okay. So this is the artery supply of the external auditory canal. Okay. So I think I have covered external auditory canal. One is the epithelium, already I told you, length, difference, nerve supply and artery supply, and after that this infection. And one thing you should remember, see, hair is present in the cartilage part only. Okay, hair is present in the cartilage part, so infection of the hair, okay, it's only happening in this cartilage part, and that is called furuncles, right? So furuncles is the infection of the hair cells in the cartilage part. Okay, so furuncles is present only in the this part. Okay, so I think now supply. And yes, one more thing, relation of the external auditory canal. Can you tell me the relation? Can you tell me the relation? Okay, so I want to write the relation there. I think it's visible. Okay, so relations, it's very easy. Can you tell me the relations? Think. Relations. Okay, so what I mean, see, here is the external auditory canal is start from here. Okay, so you tell me, if it is starting from here, then what is the superiorly? See, this is the anterior cranial fossa, this is the middle cranial fossa, this is the posterior cranial fossa. So this is the middle cranial fossa, no? So superiorly by middle cranial fossa, right? So superiorly by middle cranial fossa, right? Now inferiorly, you tell me what is here? Parotid gland, right? So inferiorly, parotid gland. Can you tell me that here anteriorly? What is it? See, you feel here what? Temporomandibular joint. So anteriorly what? TM joint. Am I right? Yes. And the posteriorly, what is this? Mastoid process. Am I right? So mastoid process, or if you want to write the content, then mastoid ear cells. Okay. So this is the relation of the external auditory canal. Okay. So now relation is over. So I think it's all about external auditory canal. Now we have to move on the one more things, that is the tympanic membrane. Okay. So I am starting tympanic membrane. Can you tell me the tympanic? Can you tell me the parts of the tympanic membrane? Okay. Can you tell me the embryology? And also can you tell me the nerve supply, artery supply, its part, quadrant, everything we will cover here. Okay. So tympanic membrane form the lateral wall of the middle ear, right? Lateral wall of the middle ear. So here is our topic, that is called tympanic membrane. Okay. Before going in the detail of the tympanic membrane, we have to know the dimensions. Okay. So come here. 9 to 10 mm. This 8 to 9 mm and 0.1 mm. Right. So this is the length. This is the length, and this is what? Width, and this is the thickness. This is the thickness. Okay. So this we have to remember. Okay. Now tympanic membrane. This tympanic membrane, it has two parts. It has two parts and the three layers. Okay. So first of all, we are discussing the layer. Tympanic membrane layers, right? So three layers. One is the outer layer, middle layer, and the inner layer. Outer layer is also called cuticular layer. Am I right? Cuticular layer. This is the fibrous layer. Outer layer is the cuticular layer. This is the fibrous layer. Okay. And last one is the inner layer. Okay. Mucosal layer. That is called mucosal layer. Am I right? So this is the three layers. Now, part of the tympanic cavity, parts. It has two parts. That is the pars flaccida and pars two parts. Okay, can you tell me the parts, pars flaccida and the second one parts? What? Tell me the second parts. Okay, and pars tensa. Okay, second is the pars tensa. This is the two parts. Now, why that is called pars tensa? Why it is pars tensa? Sorry, why it is pars flaccida? What is the reason? Okay, because it consists two layer only. Okay, and this pars tensa is consisting three layer. Yeah, I told that tympanic membrane has three layer, right? Three layer, but this pars flaccida is the uppermost part. Okay, and it's contain only two layers. This pars flaccida contains only two layers, and the pars tensa is the three layer. Okay, so this is the two parts, three layers. Okay, now quadrant. Before going on the quadrant, can you tell me the embryology of the tympanic membrane? So it's arising from the first pharyngeal arch. Yes, arising from the first pharyngeal arch. Okay, and that is from the ectoderm, mesoderm, and the endoderm. All three germs layer. Okay, so ecto, meso, and the endo. Right? All three germ layers. Okay, so first pharyngeal arch. Right? Now we are going to discuss the quadrant of the tympanic membrane. Quadrant. Okay, here is quadrants. So tympanic membrane is dividing into four quadrants with the help of two imaginary lines. So this is your tympanic membrane. Okay, and this is your Malleus, handle of the Malleus. Okay, so this is the handle of Malleus, and this is the umbu. This part is called umbu. Okay, so what I said this tympanic membrane is dividing into four quadrants by two imaginary lines. Okay, one is passing through the head of the Malleus, vertical imaginary lines passing from the handle of the Malleus. Okay, not head, handle, and one horizontal line passing through the umbu. It touches the umbu. Okay, so now this is the fourth quadrant. Okay, so this is the anterior. Okay, this is the anterior part, this is the posterior part. So, and since it is superior, so this is the antero-superiorly, this is the postero-superiorly, this is the inferior part and anterior. So antero-inferior part, and this is the postero, so postero-inferior part. Okay, so there is four quadrants. Okay, this all are the quadrants. So now tympanic membrane, and what is the directions of the tympanic membrane? Okay, directions of the tympanic membrane. That is it runs downwards, forwards, and laterally. Okay, so downwards, forwards, and laterally. One thing I want to tell you that tympanic membrane is forming 55-degree angle. Remember, with external auditory canal, 55 degree. My question is why? Why this angle is the only 55? This is the 55, no? Why? For optimum hearing. For optimum hearing purpose, right? So angle is the 55 degree angles. Okay. Now this four quadrants and all, if you want to examine the tympanic membrane, then what we will use? We will use otoscope. Okay. So that examination, we have to do examination with the help of otoscope. Okay, otoscope. Then you can see the tympanic membrane. Okay, even though lateral process of the malleus, handle of the malleus, okay, umbo, everything will be seen. Okay, one thing is here, I want to tell you that cone of light, here cone of light will be present, right? Cone of light in the antero-inferior part. So cone of the light, cone of the light in the antero-inferior part. Okay, so these are the tympanic membranes. Three. Now see how to remember. If you see, it's very easy to remember tympanic membrane. But if you still you want to, 1 minute I will tell you. First of all, now before going on the before telling the how to remember, first thing nerve supply. I am going to tell you, teach you the nerve supply. Okay, what is the nerve supply? Nerve supply. Can you tell me the nerve supply of the tympanic membrane? This is your tympanic membrane, right? This is the anterior part and this is your posterior part. Okay, and one is the medial. So your medial part is supplied by Jacobson nerve. Okay, Jacobson's nerve. Okay, this anteriorly and this posteriorly. Posteriorly by the one nerve. Anteriorly is the auriculotemporal nerve, and the posteriorly is supplied by Arnold's nerve. Okay, so nerve supply is the anterior surface of the tympanic membrane is supplied by auriculotemporal nerve. Posterior surface is the Arnold's nerve, and medially by the Jacobson's nerve. Okay, the Jacobson's nerve is the auricular branch of the vagus. Okay, am I right? This, no, sorry. This is not the auricular branch of the vagus. That is the Elderman nerves. Okay, we have read. Okay, this Jacobson nerve is the auricular branch of the tympanic, from the tympanic plexus. Okay, so from the glossopharyngeal nerve. Okay, so this all are the nerve supply. Tell me the artery supply. Artery supply of the tympanic membrane. Can I write here? Okay, artery supply. Artery supply. Tell me artery supply. I will. One is the deep auricular artery. Deep auricular artery. Deep auricular artery is a branch of. Deep auricular artery is a branch of. Deep auricular artery is a branch of first part of maxillary artery. Am I right? So I want to write here. Okay. Second artery, that is called anterior tympanic artery. Anterior tympanic artery, and last one is the posterior tympanic artery. Anterior tympanic artery is a branch of same from the first part of the maxillary artery. Okay, and the posterior tympanic artery is a branch of. Go and find it. Okay, this is from the posterior auricular artery only. Okay, from there one artery will arise, and this is the branch of that artery. Okay, so you should find it. So these all are the artery supply and the nerve supply. Okay, so tympanic membrane 4 to 55 degree angles. So now see how to remember tympanic membrane. First, okay, 1, 2, right, 3, 4. First is what? First means first pharyngeal arch, development over. Part 2. What is 3? Layer 3. 4 what? Quadrant 4. Right? So 1, 2, 3, 4. You can remember like this. 1, 2, 3, 4. Okay. This is tympanic membrane. I think most of I have covered. Okay, about tympanic membranes. Now during the examination of the tympanic membrane, what is we have to use the otoscope and we have to see the structure. This is the tympanic membrane. Okay, so light, cone of light will be seen. Okay, and this lateral process is also seen of the malleus. Okay, this ossicles we will discuss in the middle here. Okay, so part of the ossicles and everything. Okay, so I think this tympanic membrane is the more than enough, and thing is now we have to move on the wax. Okay, so there is one wax. Okay, that is also important, and the examiner asking the question about wax. Okay, what is the composition of the wax? What is the function of the wax, right? And how you will remove all other things, how you will remove the wax. Okay, so this is the tympanic membrane. So for wax, I want to clear this part. Okay, wax. Can you tell me what is the wax, and can you tell me whether it is harmful or it is useful for us? Wax. Next discussion on the wax. It is useful. Normally it is useful for, and it prevents the injuries of epithelial cells from the water or any trauma. Okay, and what is the and excessive? Okay, excessive wax can impact the tympanic membrane, and it will lead to hearing loss. Okay, so what is the common cause of the conductive hearing loss? Okay, one is causes this wax. Okay, impact wax, right? And acute otitis media, right? With the otitis, no, not otitis media with the effusion. Okay, so these are the cause for the conductive hearing loss. So we will discuss later. Okay, so now wax. Now what is the composition? Okay, examiner will ask the composition. Composition. So in the composition, what I'm telling, see, fatty acids, long chain fatty acid, long chains, right? Both saturated and unsaturated. Okay, cholesterol, am I right? Hairs, dead hairs and skin cells, right? Debris. Okay, these all are the composition. Okay, so examiner will ask one question: how you will remove the wax? How you will remove the wax? With the help of syringe only. Syringing, right? Syringing. Okay. So our answer is the, sir, we will wax we will remove by the syringes. Okay. So your answer is right. Examiner ask, he will ask next question: what is the direction of the syringe? What is the direction of the syringe? So it is the postro superior, right? So direction is the postro superior. Okay, this is the from here we have to syringe is here, no? So this is the posterior part of the external auditory canals, and postro superior somewhat here we have to inject this syringe. Okay, so this is the composition, and the wax we will remove by the syringe. Okay, what is the complication of the syringe? Tell me the complications. Yes, this is not this complication and all others not useful for first year, but it's very useful for the pre-final year. Okay, so what is the complications? Okay, it can damage the tympanic membrane. Okay, so any trauma or injury to tympanic membrane can lead. Okay, so okay, we are removing wax from the syringes. Okay, what is the, you tell me what is the contraindication of the syringes? Contraindication of the syringes, tell me. If there is acute inflammations, okay, we should not do. If there is a perforation of the tympanic membrane, we should not go with this. Tell me some other causes, what it can be. So if ear discharge is there, okay, we should not go with this. Okay, and other things is so these all are the contraindications. Okay, so whatever I told indications. So these all are the contraindications. What I said in the contraindications, one thing is the acute inflammations. Okay, one thing is the acute inflammations, and the discharge from the ear. Okay, perforation of the tympanic membrane, right? And any sharp foreign body if there in our ear. Okay, so what it will lead? If we will give this syringes, okay, press this, okay, it will go and it will damage to the tympanic membrane. Okay, we should not give it. Okay, that all are the contraindications. So this tympanic membrane over. Okay, I think it's all about tympanic membrane. Okay, artery supply and all other things are over, right? So now is I think I didn't tell you one thing about external auditory canal. I forgot on that. And direction. Okay, I told you I will tell you, but I forgot. Okay, so directions of external auditory canal. I am not telling about this. Okay, external auditory canal. Okay, so one thing. Outer part of the cartilage part, right? Cartilage part, and this is one is the bony part, right? So this bony part is runs downwards, forwards, and medially, and this cartilage part or the outer part runs upwards and backwards and the medially, right? So during the examination of the tympanic cavity or the external auditory canal, pinna has to be pulled upwards, backwards, okay, and the laterally, okay. So only we can see the tympanic membrane properly. In the infants, what happening? Pinna has to be pulled downwards and the medially, because bony part is not developed in the infants, right? So these all are the things. Okay, so we have covered so far the pinna, external auditory canals, and the tympanic membrane. Okay, so I hope artery supply. I think I told you artery supply of the tympanic cavity, and now supply already I told you. So I hope it's first pharyngeal arch. Okay, thank you.